Hi, everyone, and I'm really delighted to be spending a few minutes with you this week talking about something really critical to interprofessional practice, but that's often left out. And that's talking about how do we measure outcomes and the success associated with IPP. So, again, I hope to spend the next 20-25 minutes talking to you about this and reviewing what's in the chapter. And there's a lot of detail in the chapter, so I'd really recommend as we go through it, and then later you review that. So what do we know about evaluation? All types of evaluation are important, and there are many different types, but the more we can structure evaluation in a systematic way and through an orderly process, the more likely we'll be able to get really sound, solid information that lets us know about the efficacy, the effectiveness of our interventions, of what we're doing. And that's true whether we're talking about using a new piece of equipment in our healthcare, whether we're talking about using new medications for certain treatments or new nursing practices. And in particular, it's true when we're talking about the process-oriented, relationship-oriented, and task-oriented components associated with interprofessional practice. And so it's really important that we understand the approaches involved in evaluation and how they can be helpful to us. For any kind of evaluation, and I know all of you know this kind of thing because as nurses, this is sort of your natural process that you do, that you undertake in your clinical approach, but we collect information, we take that data and we analyze it, and we reach an opinion, a consensus. We make a determination about the quality of that information. And once we've done that, we make inferences. We extrapolate from that information what the impact of it is in reference to what we're focusing on. And it's important to recognize in particular, when we're looking at interprofessional practice, that the objects of our evaluation, the thing that we're evaluating, can be very different. So we can evaluate programs, we can evaluate activities, we could evaluate tools or resources that we use, and sometimes it's important to really evaluate what the needs are in a certain situation. So I'm just going to take a minute to talk about the fundamentals of research because it's important that we really have a sort of a clear understanding of where evaluation research or outcomes are nested within that whole broader topic of research. And all of you as BSCN students will complete both a statistics course and a research course that's essential for a 4-year honors science degree, which all of you are earning. But really important to understand how research applies to that topic of outcomes that we're looking at. So just a quick overview, reminder that there's quantitative research methods, and often we talk about quantitative research methods in terms of numbers, right? So those are observable and measurable interventions that have outcomes associated with an analysis that gives us numbers, statistics, things like that. Qualitative research methods, we often talk about stories. Those are an analysis that gives us an insight into the human experience of something, our lived experience of something, and the kinds of behaviors we may take part in. And we ask people in qualitative research to share their own experiences and their own thoughts and perceptions. Both types of research are equally scientific. So it's not that because one kind of research relies on self-report or my own sharing of my own story, that it's not as rigorous as research that involves statistics. Both are equally rigorous and equally scientific, but in very different ways. And remember, there's 3 steps in any kind of basic research process. So we need to pose a question. What is the question that we're trying to find the answer to? We need to collect data to find the answer to that question. Then we need to analyze that data and present the answer. What is the answer to the question that we began with? Okay, so we're going to carry on just a little bit further with looking at outcomes research or the fundamentals of research as we move our way to outcomes. Now, there's a kind of research that focuses on evaluation, and remarkably, we call that evaluation research. That kind of research attempts to determine the impact of something. So the impact of a program, the impact of a new technique. Let's say we have a new technique for catheterization or a new technique for de-escalation in terms of relational practice. Or a different kind of intervention. Um, the focus of that evaluation research could be patients, providers, or even on the organization. How is the organization functioning? And within evaluation research, we classify the kinds of inferences that we can make about the quality of care. And so we classify those inferences along three different dimensions, along structure dimensions. So that refers to things like what kind of facility do we need? How does the facility need to function in order to reach the kind of outcomes we're looking for? The equipment that's necessary, the resources like money and human resources that are necessary, and or the organizational structures, the reporting structures, the kinds of roles we have in leadership and things like that. So that's the structure that we can evaluate through the various elements of evaluation research. We can also look at the process that we are engaging in. So, for example, the process of delivering and receiving care, and also ultimately the outcomes. So what are the effects of the various care processes we might be involved in, and how does that impact the health status of individuals and more broadly population? And it's really critical that regardless of the kinds of research that we're involved in, that we ensure that there's validity and reliability to the research process. And that ultimately then supports us in saying that there's validity and reliability to the outcomes of our research investigation. And so validity, just as a reminder, the validity says we really need to make sure that when we say we're measuring something, we're actually measuring that thing, right? So I don't say I'm measuring quality of care, but in the end, I'm actually measuring whether or not, let's say I'm measuring how expensive care is versus the quality of the care that the patients received. So in validity, we're measuring, when we measure something and we say we're measuring a certain element, we need to make sure that we actually are measuring that. So we define it appropriately and we measure it appropriately. And then in reliability, we need to look at how consistent that measure is. So if I were to replicate this study, the process that I went through, is it reliable? Do I get the same results? And that's really critical because it can't all be one-offs. We need to make sure that we're consistent in what we're doing. Okay, so now to the meat of things. We're getting to outcomes and outcomes research. So three really important points I want to talk about. First of all, care delivery outcomes. So when we deliver healthcare to individuals, families, groups, or communities, it's really important that we look at what are the outcomes of that care, because we need to ensure that we're on the right track. We need to ensure that our interventions are most appropriate in optimizing the well-being of our clients. And so care delivery outcomes need to be observable or measurable effects of the interventions or the actions we take. So if let's say I'm offering a community-based group that focuses on harm reduction for opioid users in the community, then I need to determine what would be appropriate, observable or measurable effects of that intervention. Would it be increase in safe opioid use? Would I be saying that the focus is on behaviors that decrease risk, other kinds of things? So I would determine what those outcomes look like before I begin the process, and then move through the intervention and evaluate it. And it's really important that we focus not on the provider when we're looking at care delivery outcomes, but we're focusing on the recipient of the care, right? So if you think it's about care delivery, not the experience of providing care, but the experience of receiving care and the impact that has on either behaviors or on your various elements of your health. And so we can look at that with an individual, a group, with an organization, a family, or a community. Outcomes research broadly is a special type of research, and it's really focused on the healthcare system and healthcare delivery changes. Outcomes research really helps us to know if we are on track in delivering the kind of care in broad ways, not just to one single individual, although you can use it with one individual, but in broad strokes, in a way that really promotes the health of our populations. It refers to research that is scientific and tries to look at the various practices we're involved in and the various interventions, and then measuring the effects of those interventions, right? So how does a patient's health status change when we engage in community-based diabetes care programs, things like that. And it results in standards. So care delivery standards that are evidence-based. And for all of us as nurses, this is part of our bread and butter. It's part of what we do every day in implementing evidence-based practice. But it's so important that when we look at this outcomes research, it really leads to the development of evidence-based standards. And so in the process, it's important that we look at what are indicators in relation to the outcomes. So what are our outcome indicators? When we look at health and healthcare, those outcome indicators are really focused very heavily on two elements, morbidity. And morbidity is sort of the rate of illness. How many people are experiencing, let's say, type 2 diabetes or other kinds of things. And also mortality. And mortality is the rate of death. So how many people are actually dying from that, whatever that ailment is. And as we move into an era where we're focusing much more broadly on outcomes research and have a much greater finesse with this element, this kind of research, we are broadening our focus in terms of the indicators that we can use. So we're trying to move beyond morbidity and mortality. But at this point, those really are the two main indicators that we use. And so this we know, this is familiar to all of you, evidence-based practice. So for nursing for the last 20 years, evidence-based practice has been deeply embedded in our approaches to our everyday care. And largely within nursing, that can be traced to RNAO's huge effort within Ontario to move evidence-based practice right into the point of care by developing evidence-based practice guidelines. But if we look more broadly, evidence-based practice as a movement can be traced back into the 1970s and beyond. The original proponent was quite a hero in the world of healthcare, Dr. Archie Cochrane, who was an epidemiologist, not a traditional physician. His focus was on epidemiology. And he really came to have a real insight into the fact that physicians were trained or educated in such a way that they practiced the way they were educated and then continued to practice for much of their career the same way. So if you graduated in the 1960s, you practiced according to the standards that you had been trained with to that point. Or if you graduated in 1974, let's say, then you practiced that way forever, as opposed to constantly moving your own practice forward as new evidence emerged. And so through this analysis as an epidemiologist and looking at practice, and in particular medical practice, he developed an approach to the integration of evidence within practice as opposed to a standard that was set in time. So we are constantly changing the standard of practice based on emerging evidence because we continue to do research and to learn more. And so evidence-based practice at this point now is defined as a framework that we use in clinical practice all the time. And that framework incorporates the best available scientific evidence. So we draw that from the literature, but at the same time, it is essential that you bring into that the expertise of the clinician. So for me as an expert nurse, I bring in my own knowledge and my own expertise with an appreciation of the best available scientific literature. And also at the same time, the patient's preferences. So it's not just what I want based on my clinical expertise and what the literature says. I need to then consult with my patient and what are my patient's preferences in that situation and also their values. And bringing all of those components together, then the healthcare team in collaboration with the patient is able to make decisions about what's the best possible course of action in terms of healthcare. Evidence-based practice core competencies are essential for the educational curriculum of all health professions. In interprofessional practice, we really look at the structures in a healthcare organization. For example, things like policies, the expectations that everyone working within healthcare within that organization can have, the tools that we use within that organization to support interprofessional practice, and how those things really enable us to engage more effectively in that interprofessional approach. We structure evaluation by assessing the attributes of the setting in which it occurs, right? So when we engage in that structure evaluation, we look at the structures that are in place, the organizational structures, the elements that are essential in terms of organizational flow that enable that setting to function, and we look at whether those are effective. We also look at the processes that support interprofessional practice. And so when similar to what we've learned in chapter 2 of the textbook, processes such as communication, decision-making, and leadership are really critical. And we evaluate those in terms of what's the best available evidence to support how care should be delivered and how care should be can be received in relation to those really critical processes. Now, it's important that when we're doing evaluation, we integrate both elements to the two types of evaluation, formative evaluation, and in just a moment, I'm going to talk about summative evaluation. And both types of evaluations may use similar tools, but it's important to recognize that a formative evaluation is really looking at processes and the structures as we move forward. And when we get in a moment to summative evaluation, that's much more focused on those outcome indicators that we have predetermined before we start the process. So let's come back here now to formative evaluation. It occurs at various points throughout your program startup or the delivery of whatever service you're trying to become engaged in. Formative evaluation is essential because it helps us to know if we're on track as we move through the process, rather than wait till the end. Let's say I'm going to start my community-based type 2 diabetes education program. Rather than wait till the end of a 6-month trial to see what the outcomes were, formative evaluation allows me throughout the process to check in and to see how things are going in a way that's structured and gives me important feedback and allows me potentially to make changes as I move through rather than wait till the very end and see that something hasn't worked and I could have made a minor modification early on. So formative, it is evaluation that can happen at various points throughout the program, and quite early check-in is really important. So to begin quite early in the process. It gives us data that allows us to really check in, get feedback on the progress and the effectiveness of whatever it is we're involved in, the efforts that were made towards implementing, let's say, a model of practice in interprofessional care, for example. Often when we're looking at formative evaluation, it's carried out at the team level. So we're looking at how the team is functioning and what supports are necessary to help the team function more effectively. We look at both the structures, remember, the organizational structures that are necessary for this to work, and also the processes that we engage in. So how are we communicating? What are the team mechanisms, things like that. And again, it provides us with early indication if those approaches look like they're working. Is this supporting us in more effective interprofessional practice if we're looking at a formative evaluation for interprofessional practice models? It also is important that we involve key stakeholders so that everybody is part of this evaluation process. We don't just talk to the people, let's say, who are the leaders of developing a new approach. We talk to everybody. So for example, outside of IPP, if we're just talking about formative evaluation and we come back to that example of a type 2 diabetes educational program, it would be important that we talk to the care providers, people who are running the team or running the meetings, the group meetings, that we talk to the participants, the people who have type 2 diabetes, and that we maybe talk to some other kinds of key stakeholders. We might talk to public health or other people who are involved who have other associated programs or who make referrals to us. If we're talking about formative evaluation related to IPP very specifically, so let's say we're bringing in a new interprofessional model, the key stakeholders in that, let's say I work in a hospital, I want to lead the process of bringing in a new interprofessional practice model. I would be talking about to the different health professions who are involved in adopting that model. We'd be talking to administration who are key stakeholders because the structures and the processes may have to change as we move to a different kind of model of care. And we may even talk to patients because patients receive that care and their experience of interprofessional practice is really important. So important that we consult as we go through the process with everyone who is essential to this. Now, summative evaluation. Remember I said summative evaluation which takes place at the end, focuses much more on those outcome indicators. So in terms of summative evaluation, what we want to do is plan for this at the beginning. We don't wait till we're at the end of our implementation and say, now how do we evaluate it? We actually plan for this before we even begin the process. And we look at the overall impact of whatever our intervention or action is. And we also look at how well the processes actually unfolded, right? So let's say we're bringing in a new interprofessional model into our care facility. We would look at the outcomes of that. We would look at things like satisfaction. Remember, we've talked about that positive outcomes associated with interprofessional practice. And we know that care providers are much more satisfied with their work. The quality of the work is enhanced. Patient outcomes are enhanced, all those things. So we would do some measures of those. And we also may look at and those are clear outcome indicators. We also may look at some processes. So how effective was communication? That's a really good one. How effective were team processes through the enactment of this new model? And really important, and I think I've stressed this over the last 2 slides, that summative evaluation is really critical. It's essential. But formative evaluation is really important to make sure we're on track as we move through the process and that we're not waiting to the end to see that I could have done something a little bit more different. Okay, so how do we actually apply a framework for evaluation? And it's important that we do this when we're evaluating both interprofessional practice and interprofessional education. And the framework is really, you can just think of that as a roadmap, and that guides the user through the process of evaluation. So if we have a framework that enables us to structure an evaluation, it organizes the elements that we should be looking at, and it summarizes the focus that we have within each different component of the change that we're bringing in. A comprehensive framework should consist of the following components. These are important. So when we're implementing this framework for evaluation, instead of just sort of randomly thinking up the kinds of things I would like to evaluate at the end of my change, at the end of implementing a new IPP model, for example, I really need a framework that's going to help me stay on track to make sure that I'm evaluating everything comprehensively. And so a framework should have, first of all, guiding principles. And that sort of is the philosophical structure that holds it together. So the guiding principles for the framework. It should outline what are the concepts, what are the models or different approaches we're using for that evaluation, what are the steps that we go through in applying that evaluation, so how exactly do I do it, and then really understanding what that evaluation looks like in practice. And so what are the positive things that we can move towards in this evaluation? And that should encourage us. And what are the negative things that can happen with this evaluation that we need to avoid? And then finally, important to recognize as many of these elements as possible in any kind of framework are really helpful in enhancing the rigor of our evaluation process. So how do you choose a framework? The framework should be consistent with what you're trying to evaluate. So within this course, we're going to come back a little bit just to narrow it down a little bit. Within this course, we're focused on interprofessional practice and interprofessional education. And there's also interprofessional organizational intervention, right? So when we look at interprofessional practice, those are activities or procedures that are incorporated into our regular practice, and they improve our collaboration. And we've been talking about that throughout the course. In interprofessional education, those are interventions that occur when 2 or more professionals are learning with and about each other and improving collaboration and quality of care, both within the learning environment and subsequently in practice. And then interprofessional organizational interventions, those are changes that actually happen within an organization. So we change the actual space within an organization and who is allocated different space and how we use different space, or how we staff different areas where resourcing goes, or policies and other things. And again, those focus on enhancing collaboration and quality of care. So all of these approaches focus on enhancing collaboration and quality of care, but they can focus either on interprofessional practice, interprofessional education, or interprofessional organizational interventions. And so there's no one framework that has been shown to be the most effective for evaluating interprofessional practice. But there are some frameworks that are really effective for evaluating interprofessional education. There is the IEC PCP framework, and we've talked about that in the textbook, and you'll see that it's also in this chapter. There's the modified Kirkpatrick model for interprofessional education. I'm going to talk about that a little bit more effectively, or a little bit more in just a second. And there's the We Learn model. And I'm not going to talk much more about that, but it is included in your chapter, and it's summarized, I think, well there, and it shows the effectiveness of that model. So let's talk about this modified Kirkpatrick model. It's really commonly used for evaluating educational interventions in general. So not just in interprofessional practice, but educational interventions. The Kirkpatrick model consists of 4 levels. And so this one you'll see is modified because we've moved it to 5. And they've moved it to 5 by taking the second level and splitting it out into A and B. So the first level in the Kirkpatrick model is reaction. The second level is learning, and learning happens in a variety of ways. The third level is behavioral change, and the fourth level is the results you see. Now, what we'll see in this modified model that focuses on IPE, they've added an additional level. So the levels in the modified model are here on your PowerPoint screen, and they're also in your readings. And so the first level, reaction. And a reaction focuses on the learner's views to the learning experience and its interprofessional components. So how is the learner experiencing this? Whatever, let's say you're having a class on interprofessional practice, or you're having a simulation where you have to work collaboratively together in a clinical kind of setting. The second level involves 2 components. So 2A is the modification of attitudes and perceptions. So how are we seeing changes in attitudes and perception between the various participant groups? So how are the nurses and the physicians, or the nurses and the RTs, attitudes changing through this learning experience, right? And how do we see changes in perception or attitudes towards, in particular, their use of team approaches, or how they value team approaches, and how they see that as integral to how they can provide care for a specific client group. The evaluation level 2B we would want to look at is their acquisition of knowledge and skills. And so within this, the model that we're bringing forward, this interprofessional interprofessional education model, we look at knowledge and skills linked to interprofessional collaboration, as well as your knowledge and skills related to your essential practice component. So level 1 was your reaction. How are you experiencing the learning situation? Level 2 was looking at learning. In particular, we're looking at your attitudes and your perceptions of each other, and the different professional groups and the team approaches. And in 2B, we're looking at acquisition of knowledge and skills around interprofessional collaboration, and also knowledge and skills around the clinical components, the specific components that you're learning about. In level 3, we're looking at behavioral changes. So not only do we look at how you reacted to this, how you experienced the learning, and your attitudes and perceptions, but then not only, it's not important just to understand what you think about something, but then how you behave in relation to it. So what are those behavioral changes? Does this experience, this learning experience, change how you behave? And important to measure that. In the next level, we look at the change in organizational practice. So if we move beyond just the individual, but more broadly, does learning in an interprofessional kind of format change how organizations work? Because the individuals who then go work in those organizations have different learning experiences, they have different values and attitudes, and they have different behaviors, and ultimately does that lead to organizational changes? And then finally, does that impact the health and well-being of your clients. So benefits to patients and clients. So what do we know? And I'm going to I think we've talked about this before, but I'm going to wrap it up with a couple of slides that really remind us. What do we know about positive patient outcomes from interprofessional practice? That there is astronomical difference in the level of patient satisfaction with care and a much more positive experience with care received. That there's increased access to services across all Canadian jurisdictions and much shorter wait times when we practice interprofessionally. That there's better coordination of patient care and more comprehensive care. That there is better self-care. So when you have patients in the community who are living with chronic disease, much better self-care and much better knowledge of their own health condition, and that they have better outcomes. So much better blood pressure control has been shown, much better diabetes control, better quality of life, and better overall health status when we're working interprofessionally, and improved client self-management of their own care. And then finally, for anyone who's been to an emergency department in the last couple of years, it's really astronomical what we can experience in terms of wait times, decreased emergency room and hospital visits associated with interprofessional practice, where we have a much better web of care. And equally important, and it's not because it's almost, it sounds a little bit selfish, and it's not selfish to say that provider outcomes are as important as patient outcomes, but they are, because the system requires that the providers are there all the time providing the best possible care. And in order to do that, we need resources placed appropriately, we need processes in place, and we need relational practice that supports us to be able to do this. So what we know with an interprofessional approach in terms of the outcomes for providers is that providers have better attitudes towards interprofessional collaboration and much more positive perceptions and attitudes towards the value of teams when they work interprofessionally. There's much greater provider satisfaction with their work and with that team structure, and much more positive work experience than when you have providers who work in that siloed model that we've talked about. Enhanced provider knowledge and skills. Your ability to acquire knowledge and develop skills is exponentially accelerated when we work in interprofessional teams. And then finally, really important improvement in providers' awareness and understanding of the role and scope of all members of the team, not just their own role and scope. And we know how important that is for a safety agenda. And then the system also benefits. So increased healthcare system efficiency, so important that the system is the most efficient, and improve access to the system and coordination of healthcare services for all potential recipients of care. Phew. So that was a little bit of tough going in terms of just digging down into understanding what are evaluative components, how we structure evaluation, and what are the key foci when we're looking at outcomes of interprofessional practice. Hope that's helpful, and on we go as we move our way towards the end of the course. I hope you all have a fantastic week, and I will be back here talking to you again soon.